Hi everyone, and welcome back for another episode of the Mind Movement Health podcast. Now, before we dive into this week's episode, a small shout out to our sponsor, Paleo Valley. If you have been looking for some products to help support your health, then look no further than Paleo Valley. As I've said before, I myself take their vitamin C, their protein powder, and their turmeric supplement, and their products are second to none. Whether or not you're looking for food or supplements that are organic, tested, and really great, then look for Paleo Valley. You can grab 15% off if you head on over to the podcast show notes now and grab our coupon. All right, this week on the podcast, we are doing the episode a little bit differently. Rather than deep diving into one health topic or having an expert on where we just discuss one thing, today we're going to be chatting about a lot of different things as I answer some of the most commonly asked questions that come through. So these questions come through Instagram, through my email, but also from people in the studio. These are the questions or answers that you guys want to hear, and so I wanted to share them this week on the podcast. So whether or not you've been following me for a little while or a number of years, this will give you a little bit more insight into my philosophy around movement, healthy aging, and creating a life that supports your well-being, not just for today, but for the long term. So the first question that I wanted to answer is one that often comes through is, what does your daily routine look like? Now, I have to say, first off the bat, my daily routine is not perfect. It's not one of the Instagrammers or influence routines where it's a 4-hour routine and it's got every wellness thing involved. My routine is pretty regular, although it does change from day to day depending on if I'm teaching or not. That will sort of shift it slightly, but the fundamentals are generally the same. So I am that person the night before I get my clothes out for the next morning. For a couple of reasons. One, beats that decision fatigue. 2, I'm usually getting up earlier than my husband, so that makes sure that I'm not making too much noise. And 3, it also just makes it quicker and easier just to get up and get going because I already have everything laid out. So, those things that you do for your kids, I'm still doing them as an adult, but my clothes are already laid out. If I'm going to exercise first thing, I won't have a shower. I'll go out. Maybe I'll go for a walk. I run, I'll do some Pilates. If it's a morning where I'm teaching, I jump in the shower and then I grab Gizmo, our dog, and I take him for a walk. And then I come back and have breakfast. Now, breakfast is usually fairly similar. I like to get some fiber in first thing in the morning and some protein if I can. So I usually have a mix of LSA mix, so linseed, soy, and almonds. I add some hemp seeds, I add some flaxseed meal, some protein powder, maybe some of my muesli that I've made, and some Greek yogurt again for the protein, and full cream milk, and some berries or some type of fruit, and that's my breakfast. Pretty much stays kind of the same. Then my mornings are usually teaching, and if I'm not teaching in the morning, then I'm usually doing some podcasting, replying to emails, or doing all that behind the scenes work that happens when you run a studio that most people don't think about. Later on the day, when it comes to lunchtime, I'm often just eating some leftovers from the fridge. I'm very lucky that my studio is from home, so I get to work from home, and I cook a lot, so there's always some leftovers in the fridge. My lunches are usually some leftover protein, maybe it's chicken or beef with some type of salad. I really like to put roast veggies into my salad. I'm someone that gets really hungry because I'm active and my job is very active too. So roast veggies in there really tends to kind of pad it out for me. And again, I'm getting a little bit more fiber. Otherwise, if I'm not having roast veggie kind of salad, then it's going to be a wrap or a toasted sandwich, again with protein and plenty of veg. Today, I just had a toasted sandwich. I had made some homemade guacamole, so already off the bat, got some really good avocado, onion, tomatoes, cilantro, got that lots of flavor. Had some chicken, some veggies and rocket. And afternoon, I usually will have some type of snack. For me, it's usually an apple, banana, maybe some bliss balls or a square of dark chocolate. And in the afternoon, I'm usually either teaching a couple of classes or doing school pickup and things like that and getting kids to sports. In the evening for dinner, we do a bit of a mix. Having kids, you know what it's like. You've got to keep it interesting. We have all those faves that everybody tends to love, like spaghetti bolognese and chicken wraps and stir fries. We're just trying to mix it up. We cook mostly from home, so it's rare for us to go out. We might go out once every couple of weeks. And sticking to basics: protein, lots of veg, some type of carb. Maybe it might be rice, sweet potato. And then after dinner, occasionally we'll have some dessert. Otherwise, again, it might be a square of dark chocolate. A couple of nights a week, I'm out at dancing. So on those days when I'm dancing, I usually just do a walk with Gizmo, maybe earlier in the day. And on my other days, I'm trying to either do a Pilates workout or alternate with a weights workout with some kettlebells in the studio. So I'm trying to get a mix of cardio work, weights, Pilates, and then at least once a week I tried to get a decent run in. So anywhere between kind of 5 and 10 Ks. So as I said, my routine may look very different compared to everybody else's, but I'm quite active. Part of my day, if I don't move, I just don't feel normal for me. And it looks a little bit different just because my teaching schedule changes a little bit too. So unlike a usual sort of 9 to 5 work, I might start teaching at 7 a.m. one morning. It might be 9 a.m. the next morning. And so things just swap around a little bit. But generally, that's kind of how it works out. So a little behind the scenes there. And I always think that overall, it's about that consistency. So one week I may do 2 Pilates workouts, my 2 nights of dancing and a run, and 1 weight session. The next week I may do 2 weight sessions, 2 Pilates workouts, a run, and my dancing. So it kind of just changes from week to week, but I always try to have a mix of those movement in there anyway. All right, moving on to question number 2. Do you have to do Pilates every day? Again, another common question that comes through, mainly from people that are new to Pilates, but the answer is no, the short answer. You don't need to do Pilates every day. You also don't need to exercise every day. It's good if we give ourselves time to recover, especially if you've been unwell or you're just recovering from being unwell. It takes a little bit longer to get back into things. Pilates, I always think of it as a lifestyle. All the principles that I've learned in Pilates about focusing on form, connecting to my body and my breath and proprioception and body awareness, all these things I take into my weight training. I use in my running. I use in my dance classes because it's the principles of Pilates that we can use in everyday life and for our other sports. It doesn't necessarily mean that we have to do Pilates every day. Can you do Pilates every day? You definitely can, if that's what your jam is and you really love it. But should you be adding another movement? Yes. So again, especially as we start to get older, as women, we definitely need to be focusing on that strength training so we can prevent things like osteopenia and osteoporosis. We want to be doing some cardio work to protect our heart as well. So I think it's one of those things, if you want to do Pilates every day, go for it. But if it's at the expense of not being able to fit other activities in, then change it up and have a bit of balance, because Pilates teaches us that body awareness so that we can do all the other forms of exercise even better. And they always say, the best exercise you do is the one that you stick with. So if you really love Pilates, then do it more often. And if you really love walking, do it more often. Or if you love swimming or cycling or whatever it is, but mix it up. So again, your body's getting that strength training and that cardio training at the same time. All right, question number 3. How do you choose your retreat destinations? Now, this is a question that comes through from a lot of other business owners and a lot of people that come on my retreats and other business owners that are thinking about running retreats. I've had this question quite a lot from other businesses. Looking at sort of planning a retreat, it takes a lot of work behind the scenes. So I spend a lot of time searching the internet, finding great retreat places. And for me, they have to meet a certain criteria. I'm going to be obviously running Pilates classes while we're there. So it either needs to have a space to be able to run mat classes and breathwork classes, or it needs to have a reformer studio so that I can run reformer classes as well. And when I've been searching for my international retreats, so that we have access to reformers, I've been choosing places that have a reformer studio. One, I enjoy working with the equipment. clients enjoy working with the equipment. And two, it sets me apart from other retreats that are just doing mat work. So that's one of the things I do look for. Obviously, make sure that where we're staying, the resort we're staying, is gorgeous. Reading lots of reviews, checking out the website, looking at images and videos, making sure that it's not too far away from cultural sites or places we might want to visit, looking at the menus and the food that's on offer. Is it easy to get to? We're doing our next one in Vietnam by the Mekong. So I was checking out how many flights from Australia does it take to get to Ho Chi Minh City? We can get direct flights. So that's so much easier than picking a destination where it may take someone 3 flights to get to. So again, ease of travel. And then also, is it their local experiences that we can do? Is there going to be some cultural experiences that we can enjoy whilst we're there? So a lot of that planning goes into it. Sometimes I may reach out to people I know that have been to that destination. They will give me some ideas, or I'll read different travel blogs online so I can, again, better idea of what's more popular, what there's access to, so it's not too far away from things. So a lot of planning behind the scenes, a lot of Googling, a lot of talking to friends, family, and even people online who may have been to these places as well. So yeah, that takes a number of hours, and then it's reaching out and making contact with the resort itself and where we're staying and working out all those types of things, logistics and rates and all of that sort of thing behind the scenes. So many, many hours go into it. Lots of organization. As I said before, originally I got a job as a travel agent when I was fresh out of my university course for nutrition and food science. Travel is something I'm passionate about. So even though a lot of time and effort goes into it, it's work that I enjoy. And I think that's the main thing. And then obviously hosting the retreat, we've had such great feedback from clients that have come on retreat saying, how did you find this place? The food is amazing. All the activities are amazing. And again, just comes back from all that sort of research and thinking about the clients that are coming. I have them in mind and think about what they're going to want to do whilst they're on retreat when I'm choosing places. So yeah, great question. And just kind of, one of those behind the scenes questions on the other side. All right, moving on to question 4. Is it normal to have body aches every day as we get older? And I think the key here is every day. So a lot of people that I work with, they're in pain quite a lot of the time. They get referred to me by their doctor or their physio or their chiro because they're in pain, and that pain is pretty constant. Whether or not it's only in the morning, only in the evening, or it's all the time, that's a lot of the sort of starting base that I'm working with when I'm working with clients. So the short answer to that is pain is common, but it's not normal to have it every day. Even as we get older, unless you've been diagnosed with a condition, say something like osteoarthritis. So you may have a little bit more discomfort if the weather is colder or you're not moving compared to other days. But if you know how to manage it, then again, there should be no pain. Pain is information from our body. It's the way that our body communicates to us that something is not right. This could be because there's an imbalance between your mobility and strength. It could be because we have poor movement patterns. Maybe we're sitting for too long. Maybe we're overworking one arm in our job. It can change and occur when our hormones are changing. So this is another big one that women overlook. But as we start to go through perimenopause and then menopause, and we have that drop in estrogen, we can experience more pain due to that decrease of estrogen. A lot of time, a lot of my clients go on to HRT and the pain disappears. They didn't need more glute exercises. They didn't need to see the chiro or the osteo. They just needed to balance out their hormones. So that may be another thing to keep in mind. If you've been sort of experiencing some niggly pain only since the last couple of years, since you kind of started or entered perimenopause or menopause, then looking at the hormones may be something to just experience and explore as well. Also, it might be you're not allowing yourself enough time to recover from the activities that you're doing. If you are lifting really heavy weights, it's quite normal to be a little bit sore for the next 24 to 48 hours. But if it's going on longer than that because you're back in the weight training again straight away, then it may be time to look at spreading out those sessions a little bit further apart and looking at the practices you're doing for recovery. Are you getting enough sleep? Are you hydrating your muscles? Are you taking magnesium? Do you need to work on some mobility work rather than just focusing on that strength? So lots of explanations for why we may have pain. And I like to think that our doctors and our chiros and our physios, they are the detectives that are trying to find the reason for the pain. And then when you're coming to Pilates, we're kind of the prescription. We're working with what the doctor has said or what the physio has said to help decrease that pain. As a Pilates instructor, it's not part of our work scope to diagnose issues. It's part of our scope to work with a diagnosis to help reduce pain. But as far as the diagnosis goes, that's where you need to be working with your health professionals to receive that diagnosis first. But I always believe even if you are having chronic pain, we can reduce that pain. As I've said previously on the podcast, sometimes it's through exercise, sometimes it's through brain retraining. A lot of our pain is coming back from the brain rather than a physical ailment. Also, it may be looking to explore any emotional issues, past traumas, these types of things. Pain tends to have layers, and uncovering each layer, sometimes people's pain have more layers than other people's types of pain. And so we might need to go and uncover some of these layers to get to that root cause of the pain, to get rid of it completely. And I love the phrase that aging is inevitable, but suffering isn't. So yes, we are all going to get older. We are all going to have the odd aches and pains sometimes, but there's always something we can do. So just focus on the positives. Maybe it's improving your movement, your nutrition, your sleep habits, your hydration, lowering stress levels and inflammation. A lot of these things can help with pain, and we tend to focus on only trying to do exercise and movement, but focusing sometimes on these other things can be really helpful as well. All right, moving on to question 5. Should I have arthroscopic surgery before a joint replacement? So this question is very specific. Again, another one that I experience in the studio all the time, because I work with a lot of people that have had hip replacements, knee replacements, a couple of shoulder replacements even recently. They're sort of the most common ones that I tend to work with. And a lot of people that obviously have knee or hip pain, and they're wondering if they should have arthroscopic surgery first before they have the replacement. Now, this one is really important, and it really does depend on the person and the situation and the pain and the condition that they have. So I always recommend clients to speak to their doctor, speak to their specialists, their orthopedic surgeons, look at the evidence that they have. Maybe it's from the MRIs and the CT scans and past history of injuries. Gather all this evidence up, and then it's making a decision with these team of people. Now, in saying that, research, the most current research coming through, is showing that a knee arthroscope often offers little benefit for things like osteoarthritis or small meniscal tears, unless there's true mechanical locking of the joint. So, in this day and age, with that evidence, more and more clinicians are recommending that we avoid arthroscopic knee surgery. And I had arthroscopic knee surgery myself on my knee at 16 when I tore the meniscus. Well, I had the surgery at 21. I tore my meniscus in my knee at 16 from a dance injury. And if I had my time over again, I would not have had that surgery done because of the knowledge that I have now. Also, it didn't really change the problem. I still have frayed meniscus in there. What really made the difference was me focusing on strengthening the muscles around the joint. I don't have any issues with my knee now. Very, very occasionally it will still lock because there is some frayed meniscus in there. They clean some out. But every time we have surgery, it will damage or affect the joint, the muscles, the tendons, the ligaments around. And we can do a lot of strength work afterwards, but sometimes the integrity of that joint is never quite the same again. So lots of people, rather than having arthroscopic surgery, can benefit from exercise therapy, strength training, weight management, even just losing weight, physiotherapy, better education around what they should be doing with their nutrition and hydration and all those things we talk about. So I think it's really important to be an advocate for yourself, look into all that information, try all the non-invasive procedures that you can, or exercise therapies, all of those things. Then speak to your team of healthcare professionals. And then if you're at that point, maybe look at explorative or arthroscopic surgery before potentially looking at a joint replacement. But I think where it's lacking is really exploring all those avenues first before getting to that option of the surgery. I think a lot of people jump straight for the arthroscopic surgery thinking that's going to solve a lot of their problems, and then they come out of it and it hasn't really made a difference, or it's gotten rid of the pain that made them initially book that surgery, but it's created another problem instead. So always seek multiple opinions before going for a major surgery, as it's going to be one of the biggest life decisions that you make, and it may not always have the outcome you hoped for. So yes, look at the non-surgical options first and then proceed from there. All right, question number 6. Who should do Pilates? Again, this is a common question that often comes through on Instagram. Everyone can do Pilates, and everyone would benefit from doing Pilates. My youngest client I've had before is about 7. My eldest client at the minute is 83. So you can see across men, women, children, pregnancy, postpartum, athletes, people with neurological conditions, arthritis, injuries, pain. Everyone can benefit from Pilates, and Pilates can really meet you where you're at. So if you need to work on some basic exercises to build up strength or work on mobility, Pilates can do that. If you need it to be more sport specific because you're a tennis player or a golfer, we can work on more rotational movements and things like that. So Pilates can really be for everyone, and everyone will benefit from doing it. I don't know if that's the answer you were expecting, but that's one of the reasons I love Pilates, is that I can work with a plethora of people, and we can help everybody feel better no matter how they come into the studio, and whether or not they just want to be able to walk around the block with their dog, or they want to be able to run a marathon, or they just want to be able to sit at their desk job without pain, repetitive stress injuries in their arms. Pilates can help with it all. So it's one of the reasons I love it. Okay, moving on to our final question, and that's question number 7. And that is, how does breath work influence our health? Now, if you followed me for a little while, you know that earlier this year I completed my breathwork facilitator training. So I'm very passionate about breathwork. And most people don't think a lot about their breathing. To be honest, we just do it. Yet we take about 20,000 breaths every day. That is a lot. Our body does it over and over again for the entirety of our lives. So if you imagine even half of the breaths you do every day, if they're shallow, if they're small, if they're fast, if they're driven by the shoulders and the chest, that's going to put you in a very different state. It's going to put you in that sympathetic state, that fight or flight state. That affects your posture, your mindset, inflammation in your body, your emotions, how you react to things. So our breath is very integral to how we move, how we act, how we respond, and we have the power to change it. It is one of the only body systems that's both automatic and under conscious control. So if we're not thinking about it, we will just do it. We will continually take breaths. But when we do think about it, we can have a very positive effect to influence our nervous system just by slowing down our breathing. So when we slow down our breathing, and ideally when we're breathing through the nose and out through the nose, we can activate the vagus nerve. And this is going to move us towards that parasympathetic dominance, that rest and digest. And when we're in this state, we're going to have a lower heart rate. We're going to have lower blood pressure, lower levels of cortisol, improved digestion, better sleep, better focus, less anxiety. And if we're living in this state more often, you can see how long-term we're going to be healthier. We're not going to put our heart under it as much pressure. We're not going to have as much inflammation. We're going to be benefiting from slowing this down. And then we can connect that breath to our movement, which is what we do in Pilates. We can connect it so we get better muscle activation, better core contraction, better activation of our pelvic floor. This is going to improve our posture and our mobility and our movement. So it's all connected. And the short answer is yes, breathwork influences our health, but it influences it in multifaceted systems, especially our nervous system. I often tell people you can't always control what's happening around you, but you can influence what's happening inside you just by focusing in on your breath. Now, a great example of this just happened today when I was teaching this morning in the studio. A client had come in and her heart rate was unbelievably high. She'd been changing some medications, she's had some health issues, but her heart rate has never been this high. So what we were doing between her exercises is just stopping, taking an inhale through the nose for 4 counts, and then exhaling through the nose for 6 counts. We were slowing down that breath rate. And she could see her heart rate had gotten up to as high as 160, which is super high. And we could drop it back down to 90 to 100 just by her stopping for a minute or two and slowing her breath. So she had that control over her heart rate by focusing in on the breath. Now that is very powerful because she'd been struggling to be able to, she even said, just walking from the car into the studio. So this is then going to help going forward. Again, just regulating that breath, utilizing that breath to keep that under control while she works out the issues with the medication and things that is affecting it. So we can use breath work in many situations. Maybe it's a difficult conversation you're about to have. Maybe it's before you go to bed, when you're feeling anxious, when you have an attack of pain. This is a great time to really focus in on that breath. Before you eat, just doing a few nice slow deep breaths so you're preparing your body, getting back into that parasympathetic state so that you digest that food better. When you come into a traffic jam, when you're rushing through the airport or having to hurry for an appointment and you're feeling that little bit stressed. This is a tool available to you every minute of the day. So, of course, it affects our health. And there's lots of research on this to back all of this up. Studies show that slow breathing has shown improvements in reducing anxiety, depression, PTSD syndromes, improving our sleep quality, lowering our blood pressure and our heart rate. All of these things add up and they can, again, help improve our stress resilience. So how resilient we are to these stressful situations so that you can cope better and have less spikes in inflammation and heart rate and all of these things when we're going through time of stress. So if there's one wellness practice that I would encourage you to adopt, that would just be learning how to breathe well, taking some slow, deep breaths at a few points throughout the day. And if you catch yourself breathing quickly or breathing up into the chest or bringing those shoulders in, just learning to relax them, slow that breathing down, focus on that nasal breathing where you can. Amazing. Well, thank you so much for joining us for this Q&A episode. I always enjoy hearing what's on your mind, and it's lovely to have that chance to answer some of these questions that often come through. And if you've enjoyed this style of the show, let me know. reach out, tag me on Instagram, send me an email. Let me know that you've enjoyed this episode and we can schedule a few more in for the future. And remember, if you liked today's episode, please subscribe, head on to your favorite podcast app and hit the subscribe button. And I'll continue to help share more health information, more science-based evidence on health. And until next week, remember that your health isn't built off one day and it doesn't need to be perfect. It's just built with the small choices that we make consistently over time. Take care of yourself, have a great week, and I'll see you again next week on the podcast.